Continuity of care. So that is the number one benefit of a mobile physician, because I've met many people who say, oh, I've been with my doctor for 30 years, and it's very difficult for them to see someone else. And I've been blessed to be able to gain rapport with folks, and they say, okay, let's do it, because they understand that someone to they need to benefit from the convenience of having someone come to them, and someone who understands what they're going through, to take them to the 10, maybe 20 years that they have left in their life. And so that's the benefit when you can see them in place. So as I mentioned, I'm able to observe the fluctuations in health, and have an efficient response um, to that person, instead of them waiting 3 months for their follow-up appointment, or 6 months for a follow-up appointment in the traditional sense of doctor visits. I had someone who, again, dementia is a common thing that I encounter. So I had a caregiver who was taking care of her mother, and she had a doctor's appointment. They increased the Seroquel. It's a medication we use for anxiety and agitation, but the mother just wouldn't sleep. So then she took her to the emergency room the next day. Then she took her back to the doctor. Again, that's too much. This person needs a mobile physician. We can help with the overuse of the emergency room. We can kind of get things stabilized a little bit quicker by seeing them in their home environment as well. We mentioned a couple minutes ago the Pathways of Care program. Again, that's something that I created to help easily get patients from home health to hospice when they decline, if they have a terminal condition, get them from hospice to home health if they graduate from hospice and their terminal condition is no longer symptomatic. And then we have those palliative care patients who have various chronic conditions. A lot of them, they may get worse, or they're afraid to go to hospice. A lot of folks are scared of the H word. And so they say, oh, okay, I'll do palliative care, when they failed lines of chemo and they're still trying to get another consult, a third opinion, fourth opinion, they go on palliative care. But those are great patients too, because during that time we can educate them, and they end up understanding that hospice is the best place for them, so that they can be comfortable. So we already talked about the graduates of hospice, and those being bed bound. And again, some of them can't go back to the doctor. Some can, but most cannot.